Welcome, everybody, to our webinar today on advancing allergy and pulmonary practice performance from data to insights. My name is Scott Everett. I'm the Vice President of Healthcare Solutions here at Practical Data Solutions, and I'm joined today by our CEO, Russell Hendrickson. Thanks for joining me, Russell.
It's great to have you all here today. Thanks for joining us. Throughout today's webinar, please feel free to chat in your questions while the webinar is running. Just use the Q&A bar in your webinar tool button, and we'll be happy to take your questions throughout the webinar as they come up. If you're not familiar with PDS, we focus on healthcare analytics and reporting, and we really focus in on three key areas: financial analytics, operational analytics, and clinical analytics. And we specialize in healthcare, working with healthcare organizations. So, what you're going to learn today, we're going to really focus in on these different areas of analytics and how they apply specifically to allergy and pulmonary groups.
So a few learning objectives we have today. We want to talk about some KPIs that allergy and pulmonary practices should be tracking to stay competitive within the industry, to deliver great care. We want to talk about how to communicate those out utilizing visual dashboards and show management, executives, providers, exactly what's going on within the practice. We want to talk about performance opportunities and how those can lead to financial gains by improving performance in certain areas. We want to talk a little bit about some of the tools that can help to get you where you want to go with that. And mostly we want to talk about data-driven strategies. How can your practice become more data-driven in order to really target in on the highest opportunity potential that's out there?
And Scott, data-driven, everybody's using that buzzword today. To me, it's almost a little bit overused. But the key here, what do we mean by data-driven? What do we mean by moving from data to insights, right? So to be data-driven means there's a focus on continuous use of data. We're using data to understand what's going on. And the use of data is not just to say, what did we do? It's where are there opportunities? Where do we see performance gaps? How do we highlight and uncover those opportunities? Ultimately, so we're using data to improve performance. And that's really what we're going to talk about today. One of the challenges, though, specifically with allergy and pulmonary practices, a lot of the reports that come with those tools, they're limited.
Yeah, we have canned reports that come out of most billing systems or other software systems that are out there, but really those are not necessarily targeted to individual specialties. If we look at allergy and pulmonary, there are some certain customized KPIs that are specialty specific that they may want to track that may not be sitting within those in those systems. Some things we might want to look at are referral sources. We have different patient counts we want to look at. And, we treat patients with chronic conditions. So we may want to track retention, testing. We want to track, maybe staffing ratios and some costing data as well that may come into play. And so really just looking at one system or one set of data through canned reports isn't necessarily going to work.
So let's look and talk about what are really the cornerstones to a practice performance, and specifically, allergy and pulmonary practice performance, right? And specifically allergy and pulmonary practice performance. So, we identify really 5 key areas of practice performance: the patient experience, operations, finance, clinical, and then of course our employees and our staff. So let's dig right in and focus in on these 5 areas.
I think it's good that we have patient experience there at the top, Russell, because really when we focus on the patient, the other stuff just kind of falls into place when we do that. But what we talk about with patient experience is actually even a little bit more than just the patient satisfaction scores that we're getting from our surveys. We probably want to take a look at least the online patient reviews, the wait times, patient billing, some of those things that coordinate or correlate to patient satisfaction. So let's talk a little bit about the patient surveys. This is something that we really definitely want to make sure we're communicating out to our staff and our providers. And again, it's a little bit more in depth than just looking at what we're getting back from the surveys. There's different places where we're getting feedback from what the patients think about our particular their experience with our practice.
Yeah. And so, when we think about what are some of those KPIs that should be measured, right? Number one, patient satisfaction score. And just love breaking out these two. Typically you'll see no matter what survey tool you're using, this would the patient recommend the physician and would the patient recommend the practice? Because to me, those two are sort of the best measures of are they happy enough to say you should go here too? Are they happy enough to say, I have had a great experience at this practice and I would recommend you go. So love measuring those two right away as sort of the top patient experience metrics. But what else might we want to look at, Scott?
Yeah, so like we talk about, it's not just the what we're getting there. We may want to look at what patients are saying about us in the online reviews, looking at things like Find a Doc, looking at things like our ratings that we get, even on something like Yelp or Google reviews. Those are things that are definitely going to give us feedback that we need in order to correct any actions that we may have or be able to promote places where our patients are really satisfied. But then what are the correlating metrics? What do patients really want a lot? We look at it, being able to get in, make an appointment easily and get in quickly is a big satisfier or dissatisfier with a lot of practices. And of course, once they do get in, what's the time they're spent waiting in the clinic, in the waiting room, waiting in the exam room, things like that. Those are really kind of key correlating metrics that relate to the patient experience there.
And Scott, it's kind of fun because you'd think what do patients want the most is outcomes, right? That's typically what you would think. But what do we find and what do surveys tell us?
Yeah, it really is interesting that outcomes actually, if you look at it, ranks third. The biggest one that patients want is customer service. What they're rating us on is how they're treated by the staff, how they're treated by the care team, how they're treated by the provider. They want to feel like they're important and that they're cared about. And there was a really interesting survey that came out from Press Ganey that talked about, we look at these online reviews that are out there and patients are reading these reviews when they're going to select a provider. They're not looking at, the network or anything like that. They're looking at what are the star ratings of these providers. And it's interesting. I'm helping my daughter find a provider right now. And if that provider doesn't have at least 4 stars, she won't even consider it. So it's something that you definitely need to be made aware of.
There's just so much information that's available to the patient. So when we think about patient satisfaction scores and we think about how we might communicate back to the physician or the care team, are we just measuring an overall satisfaction score? Or are we actually providing data to be more data driven, to allow very quickly, whether it's a physician or a location, to understand would they recommend you? Would they recommend the group? In our example here, you can see they're liking the physician, but they're not so happy with the group. And you sort of very quickly see how these the key areas that they're unhappy with is getting communication over the telephone, getting in with an appointment, and even maybe some of the staff not feeling that staff is very courteous. So how we communicate and share that information can really be the difference between understanding where we have performance gaps and just kind of plodding along saying, well, we think we're doing a good job, so we must be doing a good job. So some key areas to think about when we think about patient experience.
Yeah, so one of the next cornerstones that we want to talk about is operationally, and this is what's going to drive a lot of that patient experience when we look at it. So we want to look at, our different patient counts and maybe some scheduling statistics and look at maybe how we're doing with our ancillaries and things like that. So let's take a look at some of these individual KPIs that are important. When you really look at it, one of the big things we want to really dig into is our appointment statistics and stuff that we can get out of our scheduling system. We want to start looking at, how long does it take to get an appointment? We want to look at no-show rates and maybe even short cancellation rates, things like that. And then we want to look at how much of our provider's scheduled template is being utilized and how much is not being filled with that.
Yeah, and then to continue on, some of the other key operational KPIs is, what are we doing for screening rates? What are we doing with our follow-ups? What are we doing with, skin testing? Ensuring patients even have necessary preventative care. Breaking down and looking at our mix of diagnoses. What are patients coming in for? What are some of those conditions, that are chronic or acute? and where might we be offering treatments and procedures? And then, of course, overall, based on the diagnosis, are we aligned with our procedure mix? Are we offering enough testing? Do we have a good conversion rate for immunotherapy? So quite a few operational KPIs that relate to what the patients have and what mix of services are we delivering.
Yeah, and then we may want to track even some of those more advanced procedures that we may be doing or use of the ancillary services that are out there in terms of, do we have patients coming in for rehabilitation services, injections, things like that? Are they coming in for sleep studies? Are we providing those or sending patients out for that? So tracking that may be important as well as patient retention. We talked a lot about this where we're a lot of times treating patients with chronic conditions, and we would like to be able to keep those patients. And so being able to track our retention rates and our loyalty rates can definitely be something that is helpful to better understand within the practice.
Yeah, and very specific to even allergy treatments, a great measure might be, after 1 year, after 2 year, and even after 3 year, are those patients still, following, the long-term allergy treatment protocol to drive to success? So those are some key things. And when we talk about measuring, talk about, I would hope everybody on this call says, well, I can measure those things. But the question I have for you is, can you measure them with a click? Or do you have to go download a whole couple of reports, stick them in Excel, and then maybe 2, 3, 4 hours later, you're able to get to the answer, right? So are you data driven, or are you just able to get to an answer, but it's not at your fingertips? One of the big areas that we see that too then is with how we're counting patients, right? Assigning panel size. Do we count new patient visits, recurring patient visits, patients after 2 years still in the practice? So there's a lot of different ways we might count patients.
Well, and what's interesting is you talk about visits, but visits is one of the things that there are just a whole lot of definitions of what is a visit within a practice. Some of the things that we've worked with are looking at visits as, one patient, one provider, one data service, but an encounter may be where they're seeing a couple of providers during a data service, or a case maybe when we're looking at a number of different CPTs that we're providing for a certain diagnosis, or episodes of care, maybe tracking along a long period of time to see what are these treatment statistics that we're looking at. So these visit definitions can vary from practice to practice, but the right answer is whatever works for your practice and whatever you want to track. Just make sure that you're being consistent with your definitions.
And Scott, as a longtime allergy sufferer, what we're missing on this slide is
That's
patient immunology visits where you might
Oh,
not
yeah.
see a provider. So there's a perfect another example of, do we have a way to count appropriately our patient volumes and who's coming in, and is that being data driven? Speaking of visits, let's talk about scheduling optimization, right? Can we look at our appointment lag? How quickly can get patients in? Do we have a lot of canceled or no-show appointments? And if we do, where or when and what areas? Things even looking at, are we bumping patients too often? And then how are we utilizing our physicians in that scheduling utilization?
Yeah, and these are a lot of statistics and a lot of metrics to look at. The key really is making sure that we're communicating these effectively. And so, let's take a look at a potential visualization that you may want to use within your practice. And this is an area where we can come in and we can look at some of these key statistics. Whenever I work with a client on patient access, one of the first places I always go is to the session statistics that you see in the top center there. And what that does is that gives me a good idea of the available capacity that we truly have, because we know the amounts that we can do. So why aren't we doing that in every session? So we look at that. It may be a staffing issue. It may be a patient demand issue, but we want to dig in and better understand why we're not filling to capacity every session. In addition to that, we may want to look at provider scheduling utilization rates and see which of our providers are underutilized for their booking or available time. We also may want to look at third next available, which is, potential of how quickly could we get a patient in, and compare it to our appointment lags, which is how quickly are we getting patients in, and trying to understand discrepancies there.
Yeah, it was interesting. Was just working with a practice yesterday who was analyzing their call center data, and they found they get more calls on Tuesdays than on Mondays. And yet intuitively, right? I've never even heard that, but the data told a different story, right? So when we think about when patients want to be seen, but then that appointment lag, really kind of interesting. And it was fascinating to see that they were having to staff up on Tuesdays with more people to answer the phones and book appointments. And then by the same token, they found on Fridays the call volumes dropped dramatically, which I guess isn't as big of a surprise. But really, really kind of fascinating when you look at the data and understand what's really going on. And by the same token, then we may also want to be able to cut down and provide those same metrics down at the physician level so the physicians can understand where their utilization is or their appointment lag. So being able to provide information, down at the practice level, at the location level, at the subspecialty level, really key to being data driven.
Yeah, and if we want to communicate this out at, a practice or a provider level, we may want to be able to show it in a dashboard where we can tie things together from different sources as well. It's great to look at the patient access and scheduling information, but we may want to bring in some different things like top diagnosis codes of what we're actually treating. We may want to look at our testing rates, patient counts, things like that, which aren't necessarily coming from the scheduling system. Look at our treatment mix and what we're doing there, and of course, looking at our referral rates and patient satisfaction is probably going to be key, and we probably want to reflect those scores on pretty much every dashboard that we're sending out.
Yeah, and this is a great example from a management perspective to be able to have reports that really show, the whole organization. Where are we performing? How are we performing? Are we growing, our testing, so some great examples of that. At the same time, we may also want to look at costs. We may want to bring in staffing mixes, and we may even want to look at when we're offering, the full, immunology testing, because we may not offer that in every location. So we even may want to look at, do we have the right mix of available hours for that? Do we need to potentially offer testing in more than one location? So there's a lot of different metrics that might come into play. These tend to be more allergy metrics. Scott, can you speak to a little bit of what we might want to do on the pulmonary side?
Yeah, so on the pulmonary side of things, we probably want to keep tracking our testing, our pulmonary function testing, and looking at our rates and looking at places where the testing shows some different abnormalities. We may want to look at our therapy mix and what are we treating medically, what are we treating through various therapies, what are we sending to treat through advanced surgical or procedural techniques as well. But again, the patient counts, the top diagnoses that we're seeing, and patient satisfaction being right there top center, can really be key of how tracking how well we're doing.
So we've talked a lot about the patient experience. We've talked a lot about, optimizing scheduling and some of those operational metrics, but ultimately, we look for performance gaps usually because we want to talk about strengthening the bottom line. And typically the three ways that a physician's practice can do that is either to see more patients, try to increase our market share, to improve our reimbursement, or ultimately ensure that when we get paid as quickly as possible. So that leads us right into our third area, which is to talk about the financial opportunities for organizations. And we're going to touch base on things like the revenue cycle, contracting, and getting paid quickly, and then ultimately looking at some of those different margins, especially when it comes to testing, that we may want to be mindful of. So what are some of those key KPIs, Scott, that we want to be thinking about?
Yeah, I mean, everybody's obviously tracking their charges, their payments, adjustments over time and making sure that the trends are going in the right direction. But some of the ones that they may want to be a little bit more specialty specific is looking at, revenue per visit, and looking and seeing what particular procedures are reimbursed at different rates and understand that a little bit better. They probably want to understand their payer mix, especially payer mix of patients that are getting referred in and things like that, so that they can understand what services they may need to be provided, or services that may not be covered by certain payers that are out there.
Yeah, and similarly, I hope everybody's tracking days in AR. There's not many systems that you don't have that information at your fingertips. When we think about denial and recovery rates, a lot of organizations, we'll talk about this, don't have the ability to measure after a denial, did we actually get paid? And where are we seeing denials at the procedure level, and where there might be even creating some patient frustration because certain services aren't covered. And then of course, are we collecting money at time of service where we should be, especially where patients have, high deductibles at the beginning of the year.
Yeah, and again, we probably maybe even want to track these ancillary services separately from the others and understand if we have high or low profitability of these certain services that we're providing from an ancillary standpoint. And of course, really looking at overhead expenses, tracking our highest areas of expenses, tracking where we're meeting budget or where we may be over budget and trying to reconcile that a little bit differently as well. So.
Let's talk about RVUs, Scott. A lot of the private practice allergy or pulmonary groups, they run sort of a revenue, model. Oftentimes that ties into their comp. But, as organizations grow, and especially, we're seeing more and more, multi-region organizations, growth and consolidation in both allergy and pulmonary practices, you really have to start thinking about, and do we have what we need for RVUs? So we could measure physicians that are in different regions, different states even, and a lot of different ways that RVUs can be calculated, but oftentimes those off the shelf metrics don't get us what we need. How come?
Well, billing systems usually calculate RVUs in one way. So if you get your data out of your billing system, you're going to get what you get. But a lot of times that's not good enough. We have some clients that need to have more than just those annual RVU updates. They need modifier adjustments that are put into place, and sometimes those need to be customized even by payer. A lot of them have unlisted codes or pseudo codes that don't have assignments coming from the CMS tables. And sometimes they have different RVUs based upon different compensation plans that the providers may be utilizing. They may be using benchmarks a little bit differently, things like that. So we have some clients that are using up to 4 different RVU calculations within their system based upon what they need them for. And so it's not just as simple as taking what the billing system gives us. A lot of times we need to do these custom calculations.
Yeah. And so, when we think about, RVUs, Scott, you touched on just a variety of topics, but ultimately, usually we're going to be thinking about our payers. If we're not just looking at physician performance, we're going to be thinking about how are we getting reimbursed and how do our top payers in our market reimburse per RVU if we're on fee for service contracts, right? We may be wanting to look and understand where we have payers that are underpaying us. We definitely want to understand our denial rates and then even our denial recovery rates. And ultimately, being able to benchmark which contracts are paying at what level, we may be able to even use some of that information to say, you're underpaying us compared to Medicare on these services. And, we have to be able to bring that up. So contracting just key, especially when we think about RVUs and payer contracts.
Yeah, and a lot of times we talk about increasing this reimbursement that we have out there. Increasing reimbursement isn't just about what we get in our contracts from our payers. A lot of times it's making sure that we're collecting what we need to collect on our back end in the form of deductibles, copays, things like that. And then, like you talked about, management of denials. Nothing brings down true reimbursement rates quite like denials that don't get collected subsequently. So one of the other places we talked about improving ourselves financially is looking at lag days and where is there cash tied up within our system. So what I look at this is, there are places where it takes time to get the charge into the system. There are times with time it takes to drop the charge to a claim. It takes time for the insurance to process it and send it back, and then it takes us time to follow up on everything on the back end before we can actually turn everything into cash. And so the way I like to look at it is that anytime I can reduce one of these lags even by 1 day, that means this year I'm going to collect 366 days worth of payments rather than 365. And that can be a big deal in these places. And so if you can drop many days off of this, that's just a lot of days more collections that you're going to collect this year. So really trying to improve your cash flow is something that definitely helps your bottom line.
Yeah, and the other low-hanging fruit area often is denials and making sure that you're appealing and following up on those denials, right? Because a claim that is denied and never appealed will never be paid, right? So there's lost revenue there. Not to mention the frustration that the patients may have if they're having to pick up some of the tab on your commercial insurances.
Yeah, so really, if we want to track and communicate out denials, it's interesting to think about this that not all denials are on the payer. A lot of times those are on us and things that we can do and improve on operationally in our area, particularly eligibility denials, making sure we're collecting accurate information, looking at that, and then looking at once we do that, are we sending the uh, appropriate response back out to the proper payer that way. We also want to track things like documentation denials, but really getting an understanding of what are the sources of our denials, where are they coming from, what's in our control, and what are things that's really more in the payer's control.
Yeah, so we looked a little bit at a denials visualization, and we could explore that data and even drill down to, as we talked about, our denial recovery rates. How might we put all that together, though? Again, thinking about what we might want to present, to our monthly board meetings or to the leadership of the organization. How might we summarize and bring together, all of the things we just talked about, looking at our charge lag, understanding the impact on cash flow, looking at changes in our payer mix, looking at that appointment lag. So these are just some ways that you might better represent the financial picture, within our organization.
So the next cornerstone that's really going to drive our practice is the clinical side of things, where we are going to measure outcomes and talk about quality metrics that are out there and maybe some specialty services that we're providing, that really taking care of our patients and making sure that they're receiving the best care that that we can provide within the practice. So some of these KPIs that we want to measure that are really important is again these outcomes. We want to look at treatment outcomes. We want to look at our therapy outcomes. We want to look at our allergy outcomes, things like that. But we also want to look at screening and testing that we're providing and getting a good understanding of that. And of course, you know patient satisfaction with the services that we're providing from an outcome standpoint. Do they feel better when they leave our practice? And so one of the ways that we can track this is, it's tough sometimes to get really defined clinical metrics or outcomes metrics. And so a good place to start is just with the MIPS metrics that are related to the particular specialty that you're working with, whether you're pulmonary or allergy, looking at these MIPS scores that and understanding by provider, how well are we functioning with these each particular metric that's out there.
Yeah, Scott, as you mentioned, a great place to start, either looking at what are some of the common MIPS metrics for allergy or pulmonary, as well as looking at some of the standards that are available from the National Asthma Education Prevention Program, where they have, laid out some good benchmarks for quality, as well. Thinking about clinical KPIs for pulmonary, of course, utilizing in the pulmonary function testing, thinking about preventative care, smoking cessation, a big one, obviously, managing asthma or COPD, and then, some of the other therapies that are available. And again, if you don't have payer contracts that bring quality metrics to the table, great place to start would be look at how you're performing against, some of the MIPS metrics available from CMS. You know, one of the things that I love about this dashboard and the one, Scott, that you just talked to earlier is the fact that down here below, you can see the physicians that aren't performing, we've named, and the physicians that are hitting most of their MIPS scores or are above average, are just dots. So we can try to see quickly where we might focus with some of the dashboards that we want to, again, bring and standardize so the organization has a good way to measure and monitor performance.
So one of the best ways we found to improve everything that we've just talked about, from an operational standpoint, a financial standpoint, and of course, patient engagement and patient quality is through our employees and measuring our employee engagement. One of the ways we talk about that is through turnover and recruitment, because that's not just a measure of engagement, it's a measure of costs. And so we want to make sure that we're really tracking our employee engagement, how committed they are to their work and to the practice and providing excellent care to your patients that are out there, and look at our turnover rates. Are we able to retain our good, high performing employees?
We also want to think about recruitment. How effective are we in hiring, staff, and physicians if we're trying to grow the practice. Obviously today we're still sometimes challenged with being able to get the right staff and get people on board and trained quickly. And of course, part of that is education. Are we helping develop our employees and improve skills? And then we sort of tagged on in here employee KPIs. We added referring physicians, but we're going to talk about that because even though they're not employees, there's such a key part of the success of the organization that we need to be mindful how referring physicians are thinking about us. Why are we spending time talking about employee engagement? And I'm sure you've probably already heard this, but there's been numerous studies that show when your employees are more engaged in the organization and the care of the patients and the success of the organization, it right away improves the patient experience. So every increase in employee engagement creates an increase in your patient experience and ultimately in the success of the practice.
Yeah, so again, when we think of ways we want to communicate this out, we want to talk about, some key metrics that are out there from a staffing standpoint. The biggest ones that I like to look at, because it's really the true measure of your engagement, is your turnover rates. You may be getting high employee engagement scores, but if you have high turnover, that's telling you a completely different story. So looking at those turnover rates, the other issue that you have is that high turnover leads to recruitment. And recruitment is usually costs you a lot, whether it's having to pay out recruitment bonuses or new hire bonuses, or just the costs it requires in order to, your recruitment expenses to put ads out and hire and interview. Those things take time and they take money, and so it's an increase in cost. Really, employee retention is really a critical key at this point.
So we've talked about the 5 different key areas that we want to be focused, having good KPIs and understanding what we're trying to measure. Let's talk a little bit. We've shown you some different dashboards here. We've shown you some interactive visualization software. Today, Power BI in particular, very popular, but there's a lot of other great tools that are around that make it easy to both understand the performance gaps and then tell the story. And, so if you're thinking about a data-driven strategy and you're not thinking about how do we move beyond Excel, you probably want to be thinking about some of these tools. Some of the key things, though, that organizations run into is they'll take the visualization software and then they'll use it like Excel. And of course, that works, but doesn't necessarily get us what we really need. What we really want is the ability to move from a visualization to a cube and then drill all the way down to detail.
Yeah, I think that's really the key for what we want to be able to look at is, we can paint a picture, but what we want to be able to do is interact with the reports and not just see what's going on, but we need to be able to do some analysis to say, why is it going on? And so that's what these visual tools are really so great at, is allowing us to focus in on, we know we have high and low performers, but who are the performers that are maybe lower performing groups that really pinpoint who are the ones that we can focus on to help improve. Where are areas that they may be struggling a little bit? Is it just in overall productivity? Is it the number of appointments that are being scheduled for them? Or is it something like they're not getting their charges in a timely fashion, and that would really improve their productivity? Or is it a matter of they're not coding at the same level as others in the department? And so all of these can really drive their productivity. But then we also want to, again, focus in on the patient satisfaction, where there's a balance between making sure we're highly productive, but also making sure that the patients feel that they're being heard and that their providers are spending appropriate time with them, explaining their conditions and treatment options, and working with them, making sure that the patients feel like they are cared about.
Yeah, and so this is a great example of an interactive visualization that's really blending a lot of different data so we can quickly see where those outliers are, and we might have top performers, but the patients aren't happy. So they're, cranking through visits, but they're not really, paying attention to their customer service. We may even want to blend in something like years of service so we can start to understand where we have performance gaps. Is this a new physician that maybe, needs more education and training, versus a physician that's well established with the practice. So these visualization tools make it easy to, again, identify outliers and start using data to understand the correlation between performance, patient satisfaction, and productivity. How might we want to share and show that with a physician, though, Scott?
Yeah, so getting that out at an individual physician level is something where we don't want to overwhelm them with a lot of data, but we want to make sure that the data we are presenting to them is in a nice visual format where they can see exactly what's going on. They want to be able to see certain trends or something like coding curves that you see in the bottom left there. They want to be able to look at maybe just their top 10 procedures that they're performing, but they really want to get a good handle of, their financial information and their productivity levels that are out there, and just providing it in a simple, easy to read format like you see here.
Yeah, and a lot of organizations are providing physician dashboards, that are easy to communicate, which is great. But we also have to think about how does that tie in with physician comp reporting. And probably one of the most frustrating things that we're hearing from physicians is they don't understand their comp reports. They may not have the information they need about their compensation until after even a close of a quarter. And so, to be data driven, we need to think about a strategy where the physicians are seeing their comp reports and their productivity reports. They really should be one set of reports. We shouldn't be trying to separate the two of them, especially with some of the challenges, in particular with physician retention, that you might be seeing in your allergy or pulmonary practice.
Yeah, so looking at comp reports, it's really nice for the providers to be able to go in and utilize these comp reports to self-manage. So if we want to really communicate effectively, we want to show them exactly how the compensation is being calculated. They want to be able to see kind of the correlating metrics that are driving those calculations, look at the trends that they have in their particular practice, and again, be able to make adjustments that are needed so that they can get to the level of compensation that they're truly aiming for. It's really a good way to boost productivity as well as help our providers be a little bit more satisfied in the work that they're doing.
Yeah. You know, Communicating clearly, making it easy, tying performance with their actual comp production, is ultimately that level of transparency. Why are we doing this? Why are we talking about this? Well, a couple of keys here, right? So when we think about using data and analytics and we want to be data driven, right? It's great. We're showing and sharing and providing transparency to the organization, to the staff, to the physicians as to how we're performing, where we're doing a great job, and where we want to shed light for room for improvement. Okay. You'll notice here on the chart, we talk about projecting data. This is our performance opportunity where we can say, because of low performance, if we can improve performance, can we quantify what's going on? In order to quantify, we have to be able to measure, benchmark our performance either among our peers or compared to other organizations outside to see how we're performing. So benchmarking is just key. And, really two ways we talk about that, either doing internal benchmarks, comparing ourselves to each other, or external benchmarks.
Yeah, and when we're utilizing these benchmarks effectively, what it allows us to do is ask the question, what if? And so, if we look at our organization, we can really stratify our physicians into, our highest performing physicians from a productivity standpoint. We can look at our kind of middle performers, and then the performers who are below average within the practice, and ask ourselves, what would happen if we could move those providers who were below average up to the average level? What would happen if we could move those providers who are at the average level up to the high performer level? There's going to be a significant financial bonus that comes from that, in addition to the opportunity to improve patient experience and patient engagement by getting patients in a little bit more quickly and seeing more patients.
So just what you're saying, Scott, we're talking about improving performance, right? So let's go back to an interactive visualization, and let's go back to where we started about volume of patients, because this one is so easy to see and communicate, right? So what we're looking at here is these are all of our physicians, and we've grouped the number of patients they're seeing into 4-hour sessions. And so these physicians on the left of the screen here are seeing more patients in a 4-hour session than these physicians on the right side of this chart. What's so neat about this, though, is we can quantify, we know the average reimbursement per visit per physician session. And so by lining these physicians up, we can then say, well, what if we were to move these bottom five performers? We don't know why, there may be reason for this, but what if we were to move them up to, say, the department or the practice average in this organization? And you'll see the tool highlights who those physicians are and then actually calculates the average revenue per visit increased over 6 or 12 months. So the interactive visualization, being able to understand performance gaps because we now have that benchmark, make it very easy to be able to identify and quantify or predict what would the improvement be. And that's really where we want to go when we think about being data driven. How do we predict what that improvement is?
Yeah, and we talk about being data driven and really looking at that, and we've talked a lot about lots of different KPIs that are out there, things that you should be measuring, ways to communicate that out. But really, the key to being data driven is making sure people have data. They need to have access to it and be able to work with it to understand what's going on, to balance the perspectives between what we think's going on and what the data is actually telling us is going on. And so giving end users the ability to see whether they're receiving a visual on a timely basis or whether they have the opportunity to work with the data, they got to have access to it. They've got to be able to, drill in and drill down. Management has to be able to look at it to make decisions, to talk about it in meetings, to measure how well they're doing with key initiatives that they're working for. They need to be able to have access to it and make sure that they're clear in terms of the performance gaps.
Yeah, and so I challenge you. You've joined us through this journey of metrics and being data driven, but do your dashboards, do your reports, do the people within the organization have that understanding of where we're performing well and where there are quantified, performance gaps that could be improved, whether it's with our payer contracts, whether with our staff, with our patient satisfaction scores. And ultimately, do you have data at your fingertips? So it's easy, it's quick, and you have that transparency through the organizations so everyone can self-serve and understand where those gaps are and then measure themselves and self-correct to help improve performance. So when we think about those different cornerstones of allergy and pulmonary practices that we've been talking about, I do want to share that we could help you. PDS, as a healthcare analytics company, we could help you improve your reporting, your access to data, or even understanding where those performance gaps are. And if you've seen something in this webinar and you think, well, I'd like to learn more, we'd love to hear from you. Certainly reach out to us. You can chat in your questions and we'll be happy to take them live, or you can get more information by visiting our website or just reach out to us via email, via phone, via our website. And we'd love to talk with you further about how we might be able to help you improve your organization.
Thanks for joining us today, everybody. We will make sure that we answer every question before everybody leaves today. If you have any further questions that come up later on, please feel free to reach out. Thanks for being here today.